last minute or something like that, they can watch online as well. But also, if you'll note at the bottom, some of the things that I add in there there is a digital version of of the law books that we have brought around to y'all. You can pull it up digitally. There's a link to that. There's also a link to some of the stuff that was at the back of the room. Everybody online, there were things like adult transfer court order sample, also the juvenile directory that we put out every quarter. That is online digitally. It's all in that follow-up email. So just pay attention to some of those links toward the bottom of the email, because I know it's a long email, y'all, but that's what I tend to do. If y'all are on my email list, y'all know I send out long emails. Hush, Scotty. So just pay attention to those follow-up emails. You'll get your certificate and then all that digital stuff as well you can pull up. Also, if our presenters share their presentations, I try to send those out as well. So other than that, I'm going to let Stephanie take it away now.
Okay, everybody, can you hear me okay?
Yes, ma'am.
All right, fantastic. So just like Jerry said, for those of you who have not had the privilege of meeting yet, my name is Stephanie Etheridge. I'm the juvenile court manager at the Administrative Office of the Court, and I also serve on our statewide Safe Baby Court leadership team, and also am directing the statewide implementation of our case management system in our juvenile courts, which is Quest. And so I just want to thank Jerry and all my friends at TCCY for reaching out and asking me to join you all today. I wish I could be there in person, but I have Second Look Commission meeting right after this, so I was not able to be there in person, but maybe next year we can make that happen. So one of the things I wanted to touch on quickly is that there are a lot of trainings available in addition to your youth service officer roundtable meetings that TCCY does. There's also the TJCSA mini conferences that happen each year. For those of you who may be new to juvenile court, welcome. TJCSA, Tennessee Juvenile Court Services Association, they have many conferences each year in each grand division, so East, Middle, and West. The AOC, we also do a training every June. It's a week-long training. And then we have our annual August conference. That annual August conference is a great time for everybody to get together. The judges and court staff are at the same venue, and it's just a great couple of days of training and just kind of peer-to-peer opportunities. So if you have not been to an August conference, certainly encourage you to look into doing that. We at the AOC also offer scholarships every year for the August conference. We wish that we could certainly send everybody, but that's not unfortunately we can't do that due to budgetary issues. But we do offer usually around 15 to 20 scholarships per year. And then in addition to that, TJCSA also offers some scholarships as well. So if you are interested in going to the August conference, but you don't think that your county has the funds to send you to that, please reach out anytime. I'm happy to add you to our list of folks that are interested in attending that conference. Then every year, usually at the end of the year, we have a core curriculum training that we do for all new hire juvenile court staff. It is usually a week long where you earn anywhere from 20 to 24 hours of training credit. And that is, again, geared for new hire juvenile court staff. Several years ago, we opened that up to include all juvenile court staff that are interested in doing that training. I had several that have reached out to me and said, hey, I went through that training 15 or 20 years ago. Can I go again? Said, why not? So that's open to any and all juvenile court staff that are interested in doing those trainings. Then we have the JJ CANS trainings that happen throughout the year. Those are for any juvenile court staff that are interested in accessing the validated risk and needs assessment tool that we have available on the AOC's website. There's an annual training and recertification that court staff have to go through. So that's offered several times during the year. We also have trainings that our Quest team does that you are able to earn training hours for participating in any of their trainings that they do. And then you'll hear me talk a little bit about our Safe Baby Courts in a few minutes. We have partnered with the Vanderbilt Centers of Excellence, and they have a great training platform that they have developed for our Safe Baby Courts. But really, anybody who's interested in learning more about kind of the the world of child welfare, infant mental health. So it's geared for anybody involved in those child serving systems. So whether we're talking about our judicial officers, our juvenile court staff, attorneys, child welfare staff, anybody. So it's got a lot of really great resources and trainings, online trainings that you can access and also receive credit for that. And then our court improvement program at the AOC, we also have a lot of online trainings available as well that anybody can access those. So next I want to jump into our statewide implementation of our case management system and just give a brief kind of history of that, kind of where we were or where we've been and kind of where we're headed. So back in between 2016 and really through 2021, we've had a 3-branch effort to really improve overall our juvenile court data. We've had a lot of various task forces and different study groups. We've had some national partners come in as well to kind of study what we had in Tennessee and make recommendations for how we can be more efficient and improve things moving forward. So then kind of fast forward in 2021, TCA 371187 was enacted, and that really for the first time in our state's history defined certain terms within our code, specifically around our delinquent and unruly cases, and then also established very specific data points that the juvenile courts are required to report to the AOC monthly. In 2021, the administration proposed and the legislature approved it, $1.5 million in recurring funding to the AOC for the purposes of being able to create and implement that statewide juvenile court case management system to really get our juvenile courts in a much better place to provide more efficiency, to have more consistency. And then also to provide, we had a lot of courts that did not have a full case management system for you all to specifically do the work of the youth service officer and really anybody involved with the juvenile court system. And then as a part of that, we, the AOC, contracted with Quest for that statewide case management system. We already had some juvenile courts that were on that system prior to the statewide rollout. And we also contracted with them to create our TN data portal. And that really is where all of that juvenile court data filters in every month to ensure that the courts are in compliance with 371187. So if your juvenile court is on Quest, you already know that there's not anything that you have to do additionally as far as logging into our TN data portal. Quest is automatically sending that data up to the portal for you every month. For those juvenile courts that are not yet on our statewide system, that portal is available so that they can either upload their data with a file layout from whatever system they are currently using, or they can manually enter in that data. We only have one juvenile court that is currently not reporting any data to the AOC, which I think is a big accomplishment, right? We've got 97 of our 98 juvenile courts that are and have reported data since we rolled out our TN data portal. So earlier this year, Public Chapter 179 went into effect on April 11th, and it requires that our juvenile courts have a CJIS compliant, which is, we love a good acronym, Criminal Justice Information Services. So that a CJIS compliant system basically means that you have the highest level of security that a system can obtain, both hardware and software. So we have to have a CJIS compliant centralized juvenile case management system. And then also it requires all juvenile court clerks and juvenile courts to adopt and convert to this new statewide system. So prior to 2025, so from 21 to 25, it was optional. So as we've been rolling out Quest, it's been an available option for the juvenile courts. If they wanted to adopt and transition to Quest, they could. As of April 11th of this year, it is now required. So all court clerks, juvenile court clerks, and juvenile courts convert to that new statewide system. And the AOC is responsible for obviously designating and maintaining that system, as well as the schedule for that statewide implementation. And as of this week, we have 74 of the 98 juvenile courts on the system. So really exciting kind of to see how we have really improved our juvenile courts just in a short amount of time. And this is just a map of where our implementation currently is. So all of the counties that are in dark blue have implemented Quest. And the counties that you see in orange are ones that we are currently working on. We just started working with Shelby County at the beginning of November. As you can see on this map, Davidson and Knox are already on the system. So Shelby is another big urban county, so we're excited to be working with them. And they are currently scheduled to go live on Quest July 1 of 2026. And then Franklin and Scott counties, we are currently working with them as well. So West Tennessee, y'all should be proud of yourselves. Most of West Tennessee has already gone through implementation. And so we're really, again, just proud of that work and certainly appreciate the collaboration with the courts in that effort. So Jerry also asked me to talk some about our Safe Baby Courts. So really, our Safe Baby Courts are problem-solving courts. We currently have 26 Safe Baby Courts across the state. We are in the process of adding 6 more. I'll show you a map on that in just a second. But we always like to start with what is Safe Baby Court. So in Tennessee, we adopted 0 to 3. They are our national partner in this effort. We adopted their overall approach, which, as you can see on this slide here, it is a community engagement and systems change initiative that is focused on improving how the courts, child welfare agencies, and child serving organizations work together to both improve and expedite services for children who are under juvenile court supervision. We do have a statewide vision statement for our Safe Baby Courts, and that is to achieve lasting safety, permanency, and well-being for Tennessee's infants, toddlers, and their families through a collaborative team approach. So again, just that history of our Safe Baby Courts. The ones that are in orange are our newest established sites that were established by legislation last year. And Shelby, Lauderdale, Blount, and Campbell are those 4. I mentioned just a few minutes ago that we are in the process of adding 6 more. Some of those sites have already been identified. Franklin and Scott counties are 2 of the new Safe Baby Court jurisdictions. Also, Hickman County is one. So we're really excited about that. Cumberland County is one of the new ones as well. So between now and the end of the current fiscal year, we will have a total of 32 sites operating across the state. So in Tennessee, we are really proud of this. We are leading the nation with our Safe Baby Courts in that we focus not only on children that are in foster care, but also prevention work. So non-custodial cases where children may remain in the home with one or both parents, or there may be a petition filed by DCS asking for custody to temporarily go to a relative or kinship caregiver. We have seen tremendous success across our state in both preventing children from entering the foster care system and also reunifying them with their families. When we first started working with our Safe Baby Courts and implementing them in Tennessee, 0 to 3 said, well, you can't have non-custodial cases in Safe Baby Court because the model is only designed for foster care. And, you know, we love a good challenge. And we said, well, we're going to have an intentional focus on prevention work. And so through that, 0 to 3 has now shifted their overall approach to include some limited prevention work within their overall model. And I mentioned earlier that I'm a part of our statewide Safe Baby Court leadership team. I serve on that with Sammy Mayfair, the General Counsel with the Department of Children's Services, and Elizabeth Setti-Reeve with the Tennessee Department of Mental Health and Substance Abuse Services. We have a 3-agency statewide team, and we have had the opportunity to work with other states around specifically implementing a prevention focus within their states around their Safe Baby Courts. So we have seen other states be very interested in the work that we are doing here in Tennessee, and we're really proud of that. So how is Safe Baby Court different than our traditional dependency and neglect cases? And legally speaking, it is not. So it is still a dependency and neglect case. We still have all of the statutorily required hearings. DCS still has to have all of their child and family team meetings per the policies. So legally speaking, it is not different. Where Safe Baby Court is different is that it is a holistic, non-adversarial approach to serving families. We are addressing infant mental health and child development from the very beginning of the cases throughout the life of the case. We are intentionally and actively engaging parents in the decision-making process for their children and really empowering them to do so. We're also engaging community partners to meet the needs of families. That's really where the sustainability piece comes into our Safe Baby Courts, because we hope that long after the juvenile courts and Department of Children's Services are no longer involved with families, we hope that we have really engaged community partners to wrap their hands and their services around families and really establish healthy connections for the families. Because when life happens again, because life happens to all of us in some way, we hope that we have equipped families with the tools necessary where they know who to reach out to within their own community to get the help that they may need. And hopefully they don't have to come back for the attention of the Department of Children's Services and or the juvenile court. We're also reducing time to permanency and recidivism. We have a number of data points that we, by statute, have to report on annually to the General Assembly. And so we are really looking at that reduced time to permanency and, of course, that recidivism piece, because it's not just about getting children out of the system quickly. We want to make sure, again, that we are teaching and equipping our parents with the tools necessary so that they can be healthy and thriving, not just while everybody is involved, but long term. We also have an intentional focus on frequent and quality parent-child visitation. And we've really started to shift the language away from visitation to really focus on family time. And what does that mean? And what does that quality piece look like? And then also we have a focus on co-parenting and mentoring for our parents. And that happens from day one and then throughout the life of the case. We also have some statutorily defined goals as well, which is obviously, as you see on the slide here, to stop that cycle of repeat maltreatment. We also want to make sure that we are preventing children from entering foster care whenever possible, that we are promoting timely permanency, promoting public safety through all of these reductions and different protective factors that Safe Baby Court focuses on, that we're again empowering the community and that we are helping to improve overall child safety and well-being, and also that we are healing trauma and helping to repair parent-child relationships. So I mentioned 0 to 3 and that they are our national partner in this effort. In Tennessee, not only did we adopt their overall approach to this work, but we have also adopted their core components. And that first core component focuses on interdisciplinary, collaborative, and proactive teamwork, which involves judicial and child welfare leadership, having a local community coordinator, and in Tennessee, we call them our Safe Baby Court coordinators, and then having an active community team. What we can tell you is that if you do not have strong judicial and child welfare leadership, especially strong judicial leadership, you can have every one of the other core components absolutely flawless. If you do not have that strong leadership, Safe Baby Court will not be successful. It's really critical to the success of the program. The next core component focuses on enhanced oversight and collaborative problem solving. And this is accomplished through ensuring that we have pre and post removal conferences and child and family team meetings. The next core component addresses expedited, appropriate, and effective services. So really ensuring that we have a continuum of services, not just for children, but for our parents, for caregivers, anybody and everybody that's involved with that family. The next core component focuses on trauma responsive support. So again, meeting parents where they are and unpacking that further. What really does that mean for this family? When we're talking about meeting parents where they are, being there, understanding where mom and dad are coming from, understanding that they have their own history of trauma, and continuing to meet them where they are. Where they are today is not going to be where they are 3 months from now. So we're going to need to make sure that we are being mindful of that and always engaging them and meeting them where they are in that moment. Also nurturing parents' relationships and building the strong social supports in the community, ensuring that we have frequent quality family time and concurrent planning from day one of that case throughout the life of the case. The number one goal with all of our Safe Baby Court cases, of course, is reunification. That's always primary, but making sure that we have that concurrent plan from day one in the event that reunification is not going to be an option at a reasonable amount of time. We want to make sure that we have identified early on a backup plan, if you will, with the family. So really empowering them to identify what that backup plan is going to be for their children, for their family. And the last core component focuses on continuous quality improvement. So really ensuring that we have an overall system commitment that focuses on continuous learning and improvements. So I mentioned the community aspect of Safe Baby Court, and this is just an example of how important it is to make sure that we are actively engaging everybody in our community and that they are working together to help our families, both in the immediate, to fill that immediate need, and then also, again, those longer term needs that they may have or things that may come up in the future. So you can see, I won't read through all these, but a number of different kind of umbrellas, if you will, right? So our faith-based community is a strong supporter of our Safe Baby Courts across the board. Having certified peer recovery specialists and family support specialists has been a great addition to our Safe Baby Court sites. We actually have 2 right now where the Safe Baby Court coordinator themselves, they are certified peer recovery specialists. And that has been, I think, a tremendous help to the families. They have somebody who has been in their shoes. They are walking alongside this whole journey with them, and they can relate on a personal level with them. So we're seeing a lot of really great outcomes from that as well. So another key piece of this is really valuing birth parents, not just mom, not just dad, but mom and dad. We want to make sure that parents are supported from that pre-removal to post-permanency. So even after the court closes that case out, our Safe Baby Court coordinators are maintaining contact with the family. They are making sure that post-permanency, things are still going well. And if they do need additional connections or referrals to services, they're able to help them. The Safe Baby Court team focuses on family strengths. They also help to increase the parents' capacity of self-advocacy, motivation, and confidence. They are supporting families in building those strong support systems, referring parents to any sort of trauma-informed services that are appropriate for them based on their needs that are identified. And then also creating opportunities, again, for peer support and mentorship, and then that kind of recurring theme that we talk about with meeting parents where they are. Each Safe Baby Court site has a dedicated Safe Baby Court coordinator that works full-time, and they really fill the role of almost a care coordination piece. They're making sure that all the moving parts are happening and that things are happening timely. They're also able to help identify barriers. So sometimes, we may have long wait times for services. So they are helping to kind of navigate that piece as well. And they're also able to, because they are working alongside the team, they're able to help our DCS workers. They have a lot on their plates as well. So there are some things that Safe Baby Court coordinator can do to take some of that heavy lift off the DCS workers as well. So it's definitely a collaborative team effort across the board. So I mentioned about the family time, coaching, and visitation, and just how critical this is to our Safe Baby Courts. We know that we are talking about children that are, developing very, very quickly. It is the most vulnerable population. So we want to make sure that we are providing intentional quality family time so that parents have opportunities to develop healthy attachments and strong relationships with their children. In order to qualify for Safe Baby Court, families have to have at least one child in the home that is between the ages of 0 through 3. And I mentioned earlier about how Safe Baby Court is a holistic approach. So if we have sibling groups, I know Katie's in the room, Madison County is one of our Safe Baby Courts, and they have had very large sibling groups over the years. So that entire family comes in. We don't bifurcate the case. So if we have, let's say we have a 2-month-old baby and we have a 4-year-old, we have a 9-year-old, a 13-year-old, and a 17-and-a-half-year-old, everybody comes into Safe Baby Court. And everybody benefits from this holistic wraparound approach. So our Safe Baby Court judges or magistrates and the entire Safe Baby Court team are ensuring that there is frequent quality parent-child contact with all the children. We know that when there is an intentional focus around more family time, that there is an increased likelihood of children achieving permanency within the first year. So again, we want to make sure that it is frequent, that it is meaningful, that it is individualized to that specific family, that we have that coaching piece and mentoring piece there, and also additional supports. So all of our Safe Baby Court team members are responsible for advocating for that increased family time. We are making sure that there is a realistic family time that is created during that first child and family team meeting that lets parents and children know when they can expect to have that first contact. And that's really important, because oftentimes, emotions are running high, especially at the beginning, when children are removed from the home, or maybe they remain in the home and DCS is going to take that step to file for court ordered services, whatever the case may be. It's still, an event for folks. And so helping parents and children to know the first possible time that they can see their children is really important. And we want to really encourage that happens as quickly as possible. We also want to make sure that we are keeping the baby at the forefront of the decision making. And so what does that mean? So we know that, unfortunately, if a child is removed, let's say in Stewart County, and the child comes into custody, or maybe they don't, maybe they go to a relative, but they don't live in Stewart County. Maybe they live in Montgomery County or Henry County. So there's obviously going to be some transportation that has to happen in order for the family to be able to visit with their baby, with their children. So we want to make sure that we are doing everything we can to minimize disruptions for that child during like such times as feeding time, nap time, those types of things. So again, just keeping that baby at the forefront of those decision-making process. But we want to also make sure that we are considering the age and developmental and educational needs. So I mentioned about sibling groups. We've had some truancy concerns with our school-age children. We want to make sure that we're not pulling them out of school for that family time. We still want to make family time happen, but we need to also make sure that we are addressing developmental and educational needs as well. So what can we do as a team to make sure that those things are happening, as well as that quality family time, and that is occurring again frequently and in the most natural settings? So not a situation where we've got maybe the family meets at Chick-fil-A and the kids are playing on the little playground, and mom and dad are sitting over in the corner on their phone. That's not quality time, right? That's time, but it's not quality time. We've seen within our communities, especially our rural communities, really embrace our Safe Baby Court approach. And one example I always like to share, one of our jurisdictions in Northeast Tennessee, they had a local child care center. And when we first were implementing Safe Baby Court there, they said, we can't do much, but we do want to be a part of this effort in our community. So they offered in the evening times after their child care center closed for Safe Baby Court to use their space for family time. They said that, we've got a kitchen, we've got obviously, all the things. So parents they're welcome to prepare a meal with their children. They are welcome to rock them, read to them, play with them, do artwork with them. So again, in a more natural setting. So we've seen a lot of really creative things happen across our state as a direct result of our Safe Baby Courts with this problem-solving initiative. So we also want to make sure, again, that we are identifying that family time coach. The Safe Baby Court team is doing that we are coming up with innovative methods to increase parent-child contact, that we are assisting the family in preparing for those visits, and that there's guidance that can be provided to the family by that family time coach during the visitation. Innovative methods to increase parent-child contact. I think COVID has taught us that we can certainly do things virtually. We don't want to see virtual visitation take the place of in-person family time, but certainly it could be used to provide additional contact. So we want to make sure that we are encouraging that the family time plan is reviewed at the child and family team meetings and or court hearings to see if things are going well, to see if there's an opportunity to go ahead and transition to, maybe we're going from supervised visitation to unsupervised visitation. We really want to make sure that we are moving these cases forward. One of the other things that we talk a lot about in our Safe Baby Courts is that withholding that family time should never be used as a punitive measure or response. And so kind of what does that mean? So if mom and or dad are struggling with active addiction, and they are not, let's say because of that active addiction piece, they're having a hard time scheduling their appointments and getting to those appointments that are identified on the permanency plan for them to do. Withholding that visitation should never be used as that punitive response. It should never be a carrot and a stick. Hey, mom, if you want to visit the children every Tuesday, Wednesday, and Thursday, then you have to do A, B, and C. Otherwise, you're not going to get your visitation. Because visitation is about that child. Yes, it's a benefit for the parents, of course it is. But at the end of the day, it is about that child and those children having that relationship with mom and dad and being able to continue to grow that relationship. So again, it should never be used as a punitive response and should always occur unless there is an identified and specific risk of harm to that child, or again, if we've got a sibling group, to those children. Just because a parent may test positive on a drug screen in and of itself does not mean that visitation should be suspended. If there is an identified risk of harm, that's a different conversation. But there needs to be an identified and specific risk of harm. And even then, if there is a specific risk of harm that's identified, then for that specific visitation, the team needs to get together and determine, okay, if we can't do an in-person visitation due to this specific risk of harm that's been identified, can we transition to a virtual visit for this one visitation? And the team get back together and discuss later what visitation needs to look like moving forward. Because again, it's about children having that consistent and frequent time with their parents. So one of the things that folks always want to know about is, well, is it really making a difference across the state? And the short answer is yes. So since we started this effort back in 2016, Davidson County was our first one, Grundy was the second one in 2017, and then starting in 2018, we started rolling out sites per legislation. And so since that time, we have had 754 cases, so 754 families that have been served in our safe baby courts, 754 cases representing 1,315 children. Of those children, 784 were non-custodial, 536 were custodial, and then we have 5 children that were non-custodial and custodial at some point during their time in safe baby court. So I mentioned earlier that you have to have at least one qualifying child in the home between the ages of 0 through 3. And so because of that population, the majority of our cases do involve substance use and or mental health needs by one or both parents. So of those 1,315 children, around 80% are impacted by parental substance use by one or both parents. And then around 43% have identified parental mental health needs, again, by one or both parents. And there could be some overlap in those two as well. So we may have, mom and dad may have parental substance use and identified mental health needs as well. So our permanency outcomes as of last month, and this is since we have started in Tennessee, so cases that have closed out, we've had 556 that have achieved permanency, and those are cases. Of those cases, that represents 937 children. One of the things that we talk a lot about in Safe Baby Court is really that we hope that children, from a best practice standpoint, achieve permanency within that first year. And so when you look at that last column that's showing the average number of months during the time that a family enters safe baby court until permanency is achieved, we're sitting right at that 12-month mark for reunification, which is fantastic. That's really what we want to see. And you'll see on here too that our relative kinship placements are under a year. So they're right around 10 and a half, almost 11 months. And then permanent guardianship and adoption, obviously those are directly involved with children that are in DCS custody, so those custodial cases. And permanent guardianship is almost 19 months to permanency, and then adoption is longer. And that's almost sitting right at 2 years. That is not something that we are too surprised by, just because there are other kind of legal factors that go into adoptions. Sometimes cases may go up on appeal, and so it may take longer for that full adoption process to kind of work itself through the judicial system. So we're really proud of permanency outcomes that we are seeing across the board. So we still have some work to do in some of these areas, but overall, we're really proud. And then the overall kind of average total, adding up all the permanencies together, we're right at 14.8 months, which again, we think is really good. So one of the other data points I mentioned earlier, that we have to submit an annual report to the General Assembly every year on our safe baby courts. And one of the things that we are specifically reporting out on is the family time component. So as you'll see on here, we are continuing to trend upward with our visitations. In 2023, safe baby court families received on average 10.6 visits per month. And in 2024, that increased to 12.9 visits per month, which is incredible. That's definitely not your typical visitation time, family time with our dependency neglect cases. So we're really, really proud of that effort across our safe baby courts. Service interventions per family. This is something that's also trended upward. With the exception of 2022, you'll see here that it went down a little bit, just like with the visitations, which has always been interesting to us. But in 2023, 10.7 services per family on average. And in 2024, 12.5 services per family. So again, a lot of really great work that's happening in these cases. So this slide right here is just the top 15 services that are provided to families. Probably this will not surprise any of you that are in the room or online, but that supervised visitation, that family time piece is the top service. And then alcohol and drug assessments as well, mental health assessments. So I won't read through all these, but these are those top 15 services on average that families are involved in across our safe baby courts. So this is another piece that the Department of Children's Services has pulled for us, looking at reentry within 6 months of exiting safe baby court, and reentry meaning reentering foster care. So as you can see, in 2020 and 2021, we were at 0%. In 2022, traditional dependency neglect cases, DCS was seeing a 3.2% of children were reentering foster care after their case had closed out within 6 months. Safe baby court was 1.5%, but we went a little bit further to specify that was 2 children. So across all of our sites, just 2 children. Then in 2023, you'll see on here that it increased to 2.4%, and that was 2 children. And then also we had 1 sibling group as well, or the 2 children from 1 sibling group. And then in 2024, it did increase a little bit more, as you can see on here, and it was 3.5%, and that was 5 children representing 2 cases. So again, when you look at it from that aspect of 5 children from 2 cases across all of our sites, it's still really low. Now, we would love to see it at 0% recidivism, but just 2 cases across the board, that's not a bad statistic either. So I mentioned the community aspect of this, and I always like to show some examples of the work that's happening across our state. And so we had a local church in one of the jurisdictions that did a diaper drive for safe baby court families, and they gathered over 1,500 diapers. And so that was really great, just to have that collaboration with the local church in the community to provide much needed supports for the families. So Grundy County Safe Baby Court, I like to show this one. We do have permission from the families, so just want to caveat with that. But this little fella achieved permanency through reunification. As you can see on here, that is well beyond kind of that best practice of 12 months. But that's okay, because it took the family 27 months, 826 days in safe baby court for mom and dad to get to a healthy place in their recovery where they could safely parent their child. And that, again, is okay. Mom and dad worked really, really hard. The team worked really hard to make sure that mom and dad had all the supports and services that they needed to help them be successful, again, long term. So the first picture with Judge Anderson and our Safe Baby Court coordinator, and the little fellow was obviously a baby at the time. That was the first time Judge Anderson had met the child in court. And then the picture on the opposite side of it, that was the day of Safe Baby Court graduation. So you can see some extended family support as well that attended that graduation. And then the picture in the middle, that was the day of the Safe Baby Court graduation. So as you can see, the little fellow grew quite a bit in the time that he was involved in Safe Baby Court. And really happy to share with you all that the family is continuing to do really well. So just a great outcome for this family. Murray County Safe Baby Court had a little baby that achieved permanency within 13 months, and that permanency was adoption. So, I showed you several slides ago that adoption is our longest permanency outcome as far as how many days it takes to achieve that. But this child really just barely over a year achieved permanency through adoption. So really great outcome for this family. Cannon County Safe Baby Court is one of our newer jurisdictions, and they recently had their very first Safe Baby Court graduation. And this family achieved permanency through reunification and within 5 months, so 154 days. So just a great outcome for this family as well. A lot of support within the community and from the Safe Baby Court team. And this was the day of their graduation. Okay, I'm going to see if this video will play. I know my friends at TCCY have seen this. Katie, you may have seen it as well. I just love it. So hopefully you all will be able to hear the sound. But Jerry, let me know if you can't. But this is a graduation video from one of our Safe Baby Court jurisdictions. And I think it just speaks to the incredible work that happens within our Safe Baby Courts. It was just an incredible day. One that I'm very blessed to have been a part of. We had, and you'll hear from the families, but the children were all removed from their mothers. As soon as the children were removed from the mothers, moms didn't want anything to do with, unfortunately, with the team. Despite DCS's best efforts to reengage mom and the Safe Baby Court coordinator's efforts to reengage the mothers, it was unsuccessful. The Safe Baby Court coordinator tracked down all the fathers and got them to the table, and they actively engaged with the teams. And so you will see and hear from 5 single fathers who stepped up, worked with the Safe Baby Court teams, and successfully reunified with their children. So I'm going to see if this video will play. I hope it does.
Hey, Stephanie, we're not hearing the sound, babe.
Hang on.
Yeah, make sure you're sharing the sound.
See here. Where I click for that.
The sound. She did.
Am I missing it?
Hey, Stephanie and Sasha, did you toggle on share with sound when you started back presenting, when you start sharing your screen again?
Let's see.
Yep, stop sharing. And then when you
Include
get
sound.
click share, yep, include sound.
Okay, fantastic. Thank you, friend.
You're welcome.
Okay, let's try this again.
Lewis is a son, a grandson, but most of all, most important, a father.
This is a great day for me.
Today we had graduation for both Safe Baby Court and Family Treatment Court. We had 2 Family Treatment Court graduates and 3 Safe Baby Court graduates, and they were all 5 single fathers. To see them, things that they have shared in their group together, they are bonded by that, and that's why you see the hugs, to see what they have all gone through together.
It's drug testing, presenting. Even though you work 10 hours that day, you might have a meeting or class that you gotta attend.
And so that's what's so great about the Family Treatment Court and the Safe Baby Court model, is it is a much more specific plan to that person.
3 years ago, I was putting drugs and alcohol before my kids, and Safe Baby Court helped me become a better father, and they've helped me in so many ways, and I'd just like to thank everybody that's helped me.
The only promise that was made to me, if I do the right thing, they can guarantee me to have full custody of my children in a it'll be a life-changing situation for me.
You know, I had some really good friends, and Lewis was one of the first ones that met me because we all read together at first. And we all ended up in here, now we're all graduating and getting our kids back. So, thank y'all.
We always wanted to be dad. We just, I guess, in a sense, had to be shown what to do to move towards being dad, you know? And like, we got a lot in common, and we just lean on each other.
That's one of the things I think is so exciting about having these 5 individuals all together, is that they're learning from each other. They never had maybe that role model. So it's very exciting to have the group of them all together.
They're family to me. We've done plenty of things together. We've barbecued together, we've had dinner.
Just having people that experience the same lifestyle you've experienced helps so much. Lewis is...
Oops. So see what it's all about. It's amazing. Every time I see that video, even though I was there that day and I've seen it a bunch, I still tear up. But really, again, just proud of the work that's happening across the state, both on the juvenile delinquency and unruly side, and then all of our problem-solving efforts that are happening with our safe baby courts and many other problem-solving initiatives that many of you are involved in. Just really, really proud of all that you all do and that other folks are doing across the state. So thank you. I appreciate being able to be here with you all today. And if you have any questions, I'm happy to answer them.
So Stephanie, if anybody, any of our juvenile court staff in our counties are interested in Safe Baby Court, what do they need to do if they're interested? Do they need to contact you or Elizabeth? Or what?
So just reach out to me. Certainly I need to hear from your judge and can add you all then to our list of courts that are interested in having a safe baby court. The judge has to be willing and interested in having one in order for us to add you to that list.
And of course, some of our courts I know that have been trying to get Safe Baby Court or been interested in it are wondering who would pay for the coordinator, who would pay for the training. And could you explain that a little bit?
Absolutely. So one of the great things about our state is that all of our safe baby courts are funded 100% by state appropriation. So funded by all state dollars. That money is legislatively appropriated to the Department of Children's Services. Department of Children's Services then executes an interagency agreement with the Tennessee Department of Mental Health and Substance Abuse Services. So Elizabeth is our money person. Elizabeth then executes contracts with the Safe Baby Court jurisdictions, either through their local county government, or we have some that are administered by nonprofits like Madison and Lauderdale counties. So it's really up to the judge how they want that grant contract to flow. If they want it to flow through their county government, or if they have a nonprofit, in their area or that serves their area that they would like for to be considered for that grant to run through. It's completely up to the courts.
For those in the room and online that don't know, Madison County currently has one. Actually, it was one of our first pilot programs for Safe Baby Court. It is like like Stephanie said, and Elizabeth and Sammy from DCS comes up for training, and then our own Melissa McGee. They all come whenever one comes online. And then they work through the 0 to 3 curriculum, as well as some of our other stuff like our own ACEs curriculum, BSB curriculum, and things like that. And then train the new coordinator, and as well as the wraparound team, which includes mental health professionals, CASA, if the county has one. Who else, Stephanie?
So CASA community providers, your DCS folks, to
Right.
include your foster parent support. So all your frontline people, and really just anybody and everybody that's interested in being a part of it and learning more about it. We've had, we've had county officials, we've had register of deeds, we've had, anybody and everybody you can think of. And we really encourage the teams to think outside the box, right? Your non-traditional folks. So like your local community banks, your local real estate agents, just anybody you think that could be a potential resource to the team as a whole, and also to helping families.
So, for instance, our Madison County Safe Baby Court also has ASPL recovery on the wraparound services because, of course, that's a big piece. So, as I mentioned, Madison County was one of our first ones in West Tennessee. That's the supervisor for that one's Katie Myers. Dillian is our Safe Baby Court coordinator now for it. Lauderdale will be getting one soon. That's also going to be supervised by the West Tennessee Healthcare and Katie. And then Gibson is fairly new, and they have one as well, and they're in the room as well, Stephanie.
Okay. Hey, Jennifer.
And then we've also got, since it's West Tennessee, Shelby County is coming online. Is that the only ones we've got in West Tennessee,
So
Stephanie?
you also have Henry County. Henry County has a Safe
Oh,
Baby
that's
Court.
right. I'd forgot. So like Stephanie mentioned, if you're interested in that or your judge is interested, you can get in contact with Stephanie. Also, Elizabeth can help with that too. Or if you want to let us know, we can pass that word along. I know I had a few questions on Quest, so I'm gonna call Jenny out because I know she had one. Anybody in the room got other questions besides on Safe Baby Court or any of the other things that that Stephanie mentioned? She'll get me later.
I will. We have just now got our new computer system going and we're ready to get set up for Quest. We just need to call you
Yes. Yes, please
and
do.
get that set up.
Yes.
Okay. That's all I had to say.
Hey, Jerry, I put my cell phone number into the chat box. So anybody that doesn't have it, that is interested in it, please reach out to me anytime.
Oh, okay, you already did.
Yes.
Oh, anybody else got any questions for Stephanie? Like she mentioned, her email is in the chat, but also in our directory that that I send out with a follow-up. I don't know if Stephanie knows it, but her email contact is in our directory as well for anybody that needs to get a hold of her. That is with Quest or anything else, the scholarships, things like that that she discussed. Her contact information is in that juvenile court directory. Anybody else got any questions? Going once? Going twice? Okay. Thank you, Stephanie. We
Thank
appreciate you
you.
joining us.
Thanks. Y'all have a great day.
Okay, what time is it? Oh, we're right at 10. Okay, so our next speaker will come in a little bit. So I'm gonna go ahead. We're gonna do break real quick. Y'all can but time for break so I can get the slides pulled up. I know what my agenda is. I wrote it. So as I get our PowerPoints up for our next speaker, we're going to do break. Everybody online, go ahead and go to the bathroom, get coffee. Everybody in the room, same network, and make sure you signed in, please. We'll start back in about 15, 20 minutes. Everybody online, I'm going to mute just so you don't have a lot of background noise. We will start back around 10:15, 10:20. For everybody online and in the room, this is your 1-minute warning. Okay, for everybody in the room online, we're going to do a little round robin for a few minutes. We have some new juvenile court staff and some new mental health providers that may not know each other. So we're going to go around the room and introduce ourselves. Those online, if you would like to unmute, you can. If not, I'll just read you off and tell everybody who you are, because I know most of you online. But everybody in the room, Sasha's going to pass around our mic and just let everybody know who you are and what county you're from. And if you're juvenile court or mental health, yada, yada.
Hello, everybody. Name's Casey Duncan, YSO out of Tipton County. Just got hired on about a month and a week ago, somewhere around there. So I'm still learning the ropes, helping Mr. Xavier out. This is Mr. Xavier.
Well, I don't think I can beat that, but Xavier Richardson, Youth Service Officer for Tipton County.
You heard that, Xavier.
I'm Scotty DeLashman. I'm the court administrator out of Tipton County.
I've been asked to speak for the table. We are Cary Counseling. We are part of the Juvenile Justice Reform Initiative, so we are accepting referrals through the courts and schools for youth that are at risk or who have already offended. We want to try to keep them out of being placed outside of their homes and obviously help them with what led them to court. So we have a team of therapists, case managers, and peer support. I'll pass it around for that. So I'm in a bunch of different counties, but my home office is in Huntington. Tanya Drury. I'm Cary's Director of Early Intervention Services.
For those of y'all who remember our juvenile directory, if you haven't updated it for our mental health providers, if y'all haven't updated it, check it before you leave and make sure I have all that contact. But for our juvenile court staff, that is in our directory. Most of the ones that contacts for our mental health providers is in our directory.
I am Chris Sissom. I'm in JJR case manager for Henry, Benton, and sometimes Carroll if needed.
I'm Colleen Brown. I'm peer support. My office is in Camden, but I work in all the counties that we serve.
Find everybody what counties those are, because some of our youth service officers are new.
So we serve Henry, Benton, Carroll, Weakley, and Obion counties. I'm Madison Williams. My home office is in Huntington, and I'm 100% Carroll County.
I am Kylie Sudwigs. I serve Weakley and Obion as a case manager.
I'm Renee Holcomb, and I'm a JJR therapist, and I serve Henry, Carroll, and Benton counties.
My name is Brianna Gibbs. I work as a JJR therapist for Weekly and Obion counties.
Carrie Counseling.
I am Lakeisha Shaw with Eagles Nest Services. Our main office is here in Madison County, but we also service Shelby, Tipton, Haywood, Lauderdale, Dyer, pretty much West Tennessee.
Good morning. I'm Sharika Granberry. I am one of the assistant directors with Youth Villages. I oversee our Life Set and Bright Futures program for our Rural West office, Thrive as well, and then Intercept for Paris and Dyersburg, and then Paris Foster Care, and Wendy's Wonderful Kids, which is one of our new programs.
Good morning. I'm Leah Holman, and I'm a YSO in Obion County.
Regina Whaley. I'm the other YSO in Obion County.
John Roberts, YSO, Henry County.
Good morning. I'm Roosevelt Washington, Madison County Juvenile Court Services.
I'm Hannah Wood, and I'm in training to be YSO in Henderson County.
And I'm Jenny Dininger. I'm the YSO for 4 more weeks. I'm retiring in January, and Hannah's going to be taking my position after 31 years.
Roger Boland, Chester County YSO.
Katie Myers, Safe Baby Court, Madison and Lauderdale counties.
Martha Rogers. I retired too and came back. So I retired from Shelby County Juvenile Court after 25 years and came back to Haywood County, YSO. New, but old.
I'm Lauren Qualls. I'm a juvenile probation officer in Haywood County.
Okay. I'm April Bragg. I'm a program director with Youth Villages, and I manage the programs in West Tennessee.
Hi, my name is Yvette Bean. I am a regional supervisor with Youth Villages Crisis Services, and I manage our teams in Rural West and in Memphis.
I'm Jennifer Carter, Court Administrator, Gibson County Juvenile Court.
I'm Christy Green, YSO, Gibson County Juvenile Court.
Courtney Whitaker, Gibson County Juvenile Court, YSO.
Okay. I'm Justin Jones. I'm with the Department of Children's Services, Office of Independent Living, and I cover the Northwest counties, but I sit in Henry County.
I'm Pamela Bouchard. I'm the opioid prevention specialist and mental health court liaison for Madison County Juvenile Court Services.
I'm Candace Bird, and I work as an intake counselor at Madison County Juvenile Court Services.
And I am Sasha Taylor, the Memphis Shelby County Regional Coordinator with the Tennessee Commission on Children and Youth.
Line, want to unmute and tell us who you are? If not, I'll call you out. Oh yeah, you're gonna let Kathy introduce herself.
I'm Catherine Herrera, and I'm with UT Schwartz. I'm the child welfare consultant for the state.
Online, we have Kim Smith. She's with DCS. Latonya Woods is Madison County Juvenile Courts. Melissa Douglas is Fayette County Juvenile Courts. Zanera is our own TCCY youth, part of our youth justice staff. Y'all met at one of our previous roundtables this year. And then we also have some Shelby County folks online as well.
Let's say Reese Walker is with Shelby County Detention Center, and so is Kevin Williams.
Thank y'all for all being here. We appreciate y'all. Uh-oh. There, back again. One. That out of the way. Okay. So our next speaker we have with us with DCS, Department of Children's Services, our legal services. It's Hazel O'Donnell. And she's joined us today. She's going to talk about all kinds of things with DCS Legal. Thank you for joining. She's impressed with the room.
This is nice. So I'm Hayes O'Donnell. I'm the Assistant Director of our Legislative Affairs team with the Department of Children's Services. So just to kind of give you an expectation of what we're about to go through is every year, state representatives and senators, this is not Congress, this is our local state representative and senators meet, and their main goal is to pass the budget and pass a balanced budget in our state. And for fun, they get to pass bills of things that they think need to happen in our state. So our job on the legislative team is to educate these legislators on the consequences of the laws they're passing, whether those are good or bad. So on here, we have a complication of different bills that have passed, and it's going to have a public chapter number that is going to be seen as like PC enter number there. That is basically when a bill becomes a law, it's assigned that number. And you guys can go on if you're interested and read that word for word as the language that they passed it. But we have tried to summarize it into layman's terms so it's easier to digest and a lot quicker to digest. So this is not every single bill that they have passed related to anything, but it's mostly in the realm of our department and our functions. So we will go through, and then if you guys are interested, on our website, our team publishes a report that summarizes all this information with the links to those public chapters if you'd like to read it for yourself, and just like a little bit of a longer definition or explanation of each bill. So first, sorry. So how do I get it to move to the next one? Never mind, figured it out. All right, first category is going to be regarding child safety. So we have Public Chapter 398, and this is going to be regarding witnessing child abuse and reporting domestic violence cases. That was a very big theme that we saw, people very concerned about domestic violence in the homes. So what that did is that expanded the definition of child abuse to include minors witnessing the abuse or domestic violence in their immediate family. Yeah, no problem. Reunification cannot occur until the parent makes sufficient progress on the permanency plan. The child must receive any needed mental health counseling prior to that reunification that is age appropriate. Permanency plans must include domestic violence services if that child was removed for related reasons to domestic violence, whether direct experience or witnessing. And then the department, we must submit semi-annual reports to the lawmakers on the number of children who are removed for domestic abuse, how many of those who have returned, how many of those still stay in custody, and then any other outcomes that come from that. That'll be submitted twice a year, and our first report will be submitted at the end of January. All right. Next one, Public Chapter 322. This is poverty is not neglect. So our department, we really want to fight the bias that if someone is impoverished, that does not mean they are being neglected or that the lack of money equals neglect. That was already a stance that we took, but they wanted to make sure that this was prominently defined in state statute. And we've also introduced several different trainings that help address this. We have a poverty simulation, which I actually took. What we do is we hand people a packet of information like, here's your assigned character of a family. You have to survive a week in good standing. I was a grandmother. I was like, oh, I got this. At the end of the week, both my children were in juvie and I was homeless. And it was very, very humbling. So it's definitely an experience that we're pushing to make sure people, no matter what grounds you come from, that you can understand sometimes this is a snowball effect and be compassionate. Next item is Public Chapter 162, the admissibility of child forensic interviews. So it prohibits a forensic interview from being ruled inadmissible solely because it was done by a federal agent during a federal investigation. So, or sorry, by a child advocacy center lacking agreements with local law enforcement, as long as an agreement exists between us as DCS and the district attorney general. We want to make sure these things can still be admissible in court and not have to be relived or redone, causing further trauma. Public Chapter 499. This is the offense of placing a child in imminent danger of death, injury, physical or mental impairment. You have a nice list of the items, whether that is a derivative or an analog of that. So it creates an offense for a person who knowingly engages in conduct to place a child in imminent danger by exposing them to the following list I will not pronounce. It establishes that a violation of this offense is a Class E felony. And if that child is under the age of 8, that is now a Class B felony. So next item, we're going to have our foster care and adoption. So this is one of our administration bills. Thank you. What an administration bill is essentially it is an olive branch between the executive branch and the legislative branch. So the governor comes to our state departments and they said, is there something that you guys need in state law that cannot be changed with conversations or policy or networking? And what he does is he brings those over to the legislators to say, will anyone here consider these? The leaders usually take those on and pass them on, and we help support those bills throughout that session. So this is regarding our extension of foster care program updates. When this was published, we had not yet adopted the name of Brighter Futures. So what one of this did is we expanded the foster care program eligibility from what it was at 21 to now to the age of 23. And it includes those in a state of custody at 18 that were adopted or placed in guardianship at 16 or older. It also removes a couple of different items. Previously, we provided free ID or driver's license for youth in foster care or juvenile justice programs. A law was tweaked accidentally that cut that out last year. So this was us just putting that in. So anyone over the age of 18 for Bright Futures or in our juvenile justice population to 19, we can reduce one more barrier and make sure they can get access to a free driver's license or state identification. Next item, we did that is correct. Yeah. Extension of foster care now goes by Bright Futures. That was actually a name selected by some of our foster care alumni in a brainstorming session. So that is a name they picked for themselves. And lastly, we had a pilot program that was very successful. It is the Foster Care Youth Outreach Liaison Pilot Program. So what we did is we worked with volunteers at state universities for around like 4 years to say, we need a pinpoint person on state campus to help those who are previously in the foster care system. So if they need help finding, scholarships, maybe help with rent or some new clothes for the semester or books, they can stay focused on their studies and they can come to this point person and ask for help, and they can get them that full list of resources and start organizing that while they can stay closed in on their school. That was very successful. So now it was opened up to every single school. It is on a voluntary basis. They just come to us. We organize with their volunteer, their pinpoint person, and it's usually like a guardian, like the therapist on campus that usually takes on that role, or guidance counselor. And we work with them and they have a direct communication with our department. So if they don't have an answer, they can come to us and we can provide that to them. That also includes technical schools as well. Next item, we have Public Chapter 387. You guys might have heard or seen this on the news. It's the Foster Child Bill of Rights. So this just outlines a lot of rights that foster children have and should have and maintain. So previously, people know that we've had a foster care or foster parent Bill of Rights. And people are like, foster children. So we actually had previous foster children, active foster children, help engage in this process as well. And they even went up and testified at the state capitol for this. So it requires that foster children, DCS custody, or contracted care have rights to education, appropriate care, including, medical, mental health, a safe environment, freedom to report any such violations without retaliation, and unrestricted access to their legal advocates. And this is reviewed with them on a regular basis and as soon as they come in. And we're actually right now gearing up additional resources like videos that like younger children can access and pamphlets for all the different ages of youth to kind of keep and carry to make sure and advocate for that. We are creating rules, which is just all the finer details that are not mentioned in the law. And those will be coming up soon. We're training all of our staff on that, has to be finalized by February 1st of next year. And then all new staff that we are onboarding, that is already included in their training as of now. Within their first 30 days, they are taught this. Part of that is that age appropriate material I was just talking about. and that is reviewed annually. And then every 5 years, we are going back and we're revisiting this to say, do we need to ramp up this Bill of Rights for foster children? And foster children will be involved in that process. Next, we have Public Chapter 79. This was another one of our administration bills. This is access to adoption records. So previously, to access your adoption record, you had to wait to be 21, and your adoptive parent couldn't access it. No one else could access it. Once you're adopted, your record is sealed. We were seeing issues with that, like if you had a medical issue, needed to go to the doctor, they're like, we need your medical records. If you didn't already have a copy, you no longer had access to that if you could not find them. So this is allowing adoptees, their adoptive parents, us, and the district attorneys to access adoption records under specific circumstances. So it lowers the age from adoptees to access their records from 21 to 18 or earlier if they're emancipated. It allows the adoptive parents to access the full records until the child's 18th birthday. Then it also permits unsealing the records for child abuse investigations, legal actions, like if we're trying to find a family member, different stuff like that. Or if the district attorney is working on trying to persecute, sometimes criminal cases can often last much longer than our custodial cases. So this can give them access to that information without having to have a child come back and testify. Public Chapter 393, it's another open adoption records for the purposes of finding placement. So once again, this just kind of specifies in more detail that our department is allowed to open specific adoption records to search for kinship and relative placements for children in our care. Next, you guys, juvenile justice. So PC 281 creates the Tennessee Juvenile Justice Review Commission. We already have a similar commission for custodial cases where they go and they get a random selection of cases that they essentially review in depth to see, is there something we could have done to A, keep this child out of custody, B, made sure this case ran smoother or faster, or address any hiccups that were in that case or any issues. So this creates the juvenile justice version of that. It provides the findings. We provide those every year to the legislature so they can give recommendations for any potential new laws that they think may need to be changed to address these issues. So they will meet quarterly beginning November 20 of 2025. They already have. And on this commission, you actually have senators, representatives, you have agency heads from our department, you have juvenile justice professionals, you have law enforcement, and you also have child development like experts on there as well to give various viewpoints onto that commission. We have to provide an annual case profile table from the previous year identifying certain random case samplings. And traditionally, they kind of want some of the worst cases to look at, right? Because they're here to find solutions. Next, we have Public Chapter 418. It is regarding TASER to study the availability of housing and treatment for juvenile offenders. TASER is a Tennessee organization that's a part of the legislature they host, where they go in and they basically do deep research studies into situations or events to provide that information on a public platform and to the legislators to see, hey, where do we need to navigate this? If we need any laws, or is this okay? Do we need to address this with the right parties? They can kind of bring everyone to the table. So this requires them to study the availability of housing and treatment facilities for juvenile offenders in DCS custody, as well as local detention centers and facilities for juveniles that are held pre-adjudication. Findings and recommendations have to be reported by January 31st of 2026. So they're currently ongoing some of these studies, and they've already held some public meetings with that you guys can go back and watch. And actually my counterpart, our director, testified in that from the DCS perspective as well. Okay, next, Public Chapter 414. It's the use of juvenile records to set bail. It authorizes courts to use juvenile court records from the past 5 years in pretrial bond reports, felony pre-sentence investigations, and firearm prohibition proceedings. It requires magistrates to consider defendants' prior juvenile record when setting bail to ensure the public safety. And you're going to start seeing a theme with a lot of this from some of the recent school shootings we've had in the state. So that was a very big topic on, how do we address this? How can we check in the history of a juvenile when working with items like this? Public Chapter 292 is a suspension of a minor's driving privileges. It requires a 1-year suspension of driver's privileges for minors adjudicated for bullying or cyberbullying. It allows a restricted license if it's a first offense with a $20 fee and court ordered to be submitted to the Department of Safety within 10 days. They essentially saw a lot of online cyber, with the development and continued progress of our socials. This was something that they wanted to have and have a law addressing. Next item, Public Chapter 254, dedicated courtroom in proximity to juvenile detention centers. I don't know if any of you guys heard about, some of the drama that was just going on over in West Tennessee and I think Memphis with like, where do we go for our courtrooms for juvenile hearings? So this is part of what that came out from. It requires juvenile delinquency proceedings to be held in a county-provided dedicated courtroom closest to the approved juvenile detention center. So previously, a brand new courtroom was built, but the other one was, they were used to going there, so they kept using the old one. They're like, we spent all this money. We want to use this one, but like, how do you make someone do this? This was their solution. The T, you guys. So this exempts courts with written agreements for detention or temporary custody with licensed institutions, public agencies or us, DCS. It clarifies that approved detention facilities must be court controlled or approved by private agencies. And that was another item of like, who runs that? Is it the sheriffs? Is it the courts? This provides that clarity. All right. Next item, we have a lot of our legal technical bills. Full disclosure, I'm a humble civilian. We have a full team of lawyers that I absolutely adore, and they spend tons of money and time becoming legal experts. I am not, and I will do my best to answer any legal questions that you guys may have, but it is not legal advice. Full disclosure. So first, Public Chapter 420, it's a voluntary surrender of an infant within 45 days. If you guys are familiar with Safe Haven, that is what this is. So previously, Safe Haven law stated that you had 14 days to surrender a child without repercussions as long as they were not abused or neglected. This is us expanding that to 45 days, that the mother or father, well, mother, may surrender her infant under Tennessee Safe Haven laws without being subject to criminal liability. Public Chapter 472, this is an increase in the child abuse penalty. It increases the penalty from a Class A misdemeanor to a Class C felony for a person who commits child abuse by knowingly treating a child between the ages of 9 and 17 in such a manner as to inflict harm or injury. The reason for that age gap of just 9 to 17, that's already in place for our 0 to 8-year-olds. And so people are like, why did we stop at 8? This is us just expanding it to the full age. Public Chapter 265. This is the extension of Abriel's law. So this allows courts to consider statutory factors, including potential abuse when making custodial decisions. Abriel's law was originally brought back out a few years ago. It was a custodial case where there was abuse happening. One parent tried to fight it. The child went home with the other, where the child then later died. So it was a lot of education on domestic matters in a household and for judges to kind of learn and train on the impact of abuse in a household. So one of this is just kind of furthering that as well. It requires, providing written findings when you're making a determination on such cases. Instead of just verbally stating it, they want that written. It adds parental restrictions, a parenting time, and failure to pay child support as factors. It also creates a rebuttable presumption that a parent with restricted contact bears the cost of supervised visitation if prior findings were made, and that's findings of abuse or neglect. It also expands abuse to include acts of third parties on behalf of the offender. So if like mom over here got Auntie Jane to go do something on her behalf and we could link it, that's what that's talking about. Lastly, it applies to cases filed on or after the effective date, so it is not retroactive. And just in case, if you guys can all see that, I should have said this at the beginning. On the bottom left of your screen, you will see an effective date. So that is the date that laws have to be enacted by. So sometimes just because a law is passed does not mean it is immediately in action. Oftentimes you see them July 1st, 2025, because fun fact, that's the start of the new fiscal year. So unless there's something that needs more time to enact a law, whether making policy or training or making some new system up, you'll usually see that date. Public Chapter 179. It is our centralized juvenile justice case management system and school shooting records. So it requires AOC, the Administrative Office of the Courts, to maintain a CJIS compliant centralized statewide juvenile case management system, kind of like how DCS has TFACS or our new oncoming CWIS. This is something for them so they can have statewide compliance, consistency, and access to all those. It also opens up juvenile delinquency records to public inspection if the individual committed a school ground homicide and is deceased, regardless of the adjudication or conviction. Once again, this is kind of a throwback to a lot of the school shootings our state experienced previously. Information in a file or juvenile record that directly or indirectly identifies another juvenile does have to be redacted to respect that family's privacy. I think I went too far. How do I go back? Sorry, you guys, I am not used to all this fancy technology back in my office. Okay, yeah, go back. Perfect. Thank you. Thank you. So Public Chapter 386, it basically allows a single petition for siblings in an adoption. So previously people had to file an individual adoption petition for each child in a sibling group. And that just says you can file one petition, save time, saves cost, unless best interest says that you need to separate those petitions out. Next item, Public Chapter 390. This clarifies token financial support and informed consent for vaccinations. Vaccinations became a very big hot topic after COVID. So this clarifies that a biological or alleged father who provides only token support is not considered a putative father. Also allows entities to file a Rule 72 declaration with an adoption order instead of an affidavit detailing service fees. And then kind of back to that informed consent. It allows perspective to those authorized to give informed consent for a minor's vaccination. So previously, only the biological parent was able to give informed consent for a child to get vaccinated. Our department would have to go and get a court order. We're saying like, hey, what if they've been, TPR, termination of parental rights, have already been enacted? We would have to wait until their entire appeal period was over, which could be a very long time. So we're saying for those who are in a pre-adoptive home and that home has been approved for adoption, that's the trail, this law now gives them consent for those vaccines on behalf of their potential adoptive children. Next item, Public Chapter 500. This requires posting of legal notices on website. So previously, we did have to post, but they're saying we need to make sure we post on multiple platforms. They cannot be behind a paywall and they cannot be owned by the same person. It is just making sure that any notices that are put out there can be seen by different people, right? People who are on Fox may not read stuff that's on like BSN. That's not where we are posting these. I want to make that very clear. Bad joke. So this is kind of our miscellaneous. This is our HR. This is our fiscal. This is a lot of the other leftover stuff. So Public Chapter 512, it is our state agency reporting federal funding. States right now, there's a very big trend on wanting to get more involved in what the federal government is doing. So this is essentially saying that we have to notify or get approval for any type of federal fundings we receive over certain amounts. Sometimes it's just notification. Other times we cannot accept those funds until we get explicit approval from the legislator on that. Of course, this exempts emergency aid, mandated programs like Medicaid, and any type of recurring annual grants. Public Chapter 397, this is the End Childhood Hunger Act. So this enacts the End Childhood Hunger Act, creating a task force under the Department of Human Services to develop a strategic plan to end childhood hunger. We are serving on that task force to help, since so many of our families do experience this. That report is due to the General Assembly, the legislators, July 1st, 2026. So stay tuned. Next, we have Public Chapter 144. This creates an advisory task force on state reimbursement rates. So that's to recommend an annual adjustment for adequate compensation to healthcare service agencies. Once again, we will be serving on that task force. It's attached and run by the Department of Labor and Workforce Development. They are going to recommend changes to salaries, benefits, administrative costs, and address healthcare workforce shortages. Public Chapter 47. This is kind of getting a little bit more technical, but it's bereavement leave for state employees. So this is now kind of expanding some leave that you guys could potentially get. So it's 3 days for the death of siblings, grandparents, grandchildren, foster parents, or in-laws, 5 days for parents or step-parents, and 10 days for a spouse, child, or stepchild. So pretty big and pretty new. Public Chapter 163, it authorizes eligible education employees to receive paid family leave during legal adoption process through that final order to give them time to kind of welcome that child home during all that legal stuff that's happening. Give a little bit of calm and normalcy. Next, this is expanding the state employee leave, Public Chapter 423. It's eligible to full-time state employees up to 6 work weeks for the birth or adoption of a child. This includes leave requested to care for a family member in hospice. It also can be taken, it can be taken continuously or intermittently under FMLA and has to be used within 12 months of the event. It is limited to 6 work weeks per 12-month period. Next, Public Chapter 495. This is our child advocacy funding. So this requires each child advocacy center contract to be set at the base net of 127 grand, and each forensic child interviewer contract at 85 per interviewer. So this is starting July 1st, 2025, that fiscal year once again. Contracts newly entered, renewed or amended, they receive an automatic 3% increase the following July if the state funding board certifies at least 1% of the general revenue fund. That's a fancy way of saying like, hey, how much did the state actually make last year? If it's more than 1% of the previous year, CACs get an automatic 3%. This was a big advocate. People are very close and friendly with our CACs, and they had not received an adequate pay or any pay increase in like the past 20 years. So this is kind of an adjustment for that, and that's why they also put in that second part for the automatic increase since that item is put in statute. Public Chapter 530, this is the appropriations bill. And essentially, like I said at the beginning, the only job of a state legislator is to pass a balanced budget. And this is that balanced budget. If you open this hyperlink, you will see like a 500-page document. It is the budget for the entire state, every single department. So these are some of the highlights that we have. It appropriates $59.8 billion for the entire fiscal year for the state. Over 171 million of that is increases towards the Department of Children's Services, raising our total budget to 1.5 million. 56 million of that was for residential custody, because what we're seeing is a trend in, while our overall custodial numbers are lower, we are seeing an increase into the acute needs category that are coming in. So we need access to more residential treatment, and sometimes those stays are also longer and just more expensive in general. We have $3 million to modernize our foster care extension program. Part of that is where we give a regular stipend and we are increasing that stipend. Previously, it was like $400. All right, I'm from Nashville, but I even know here you cannot get rent for $400. So we over doubled that to help, either with books, help rent. We also have other resources, but that's a monthly recurring stipend that they get to help ease some tensions. We have $9 million for provider rate increases. We have $6 million for our safe baby courts. We are expanding those out into other counties, and $10 million to expand our intercept programs as well, because we've seen a great success with keeping children out of care and keeping children stabilized in their homes. Then we also have additional fleet vehicles, so our staff do not have to use their personal and put wear and tear on their vehicles. But that is the end of my presentation. Are there any questions, or do we do that here? Great. Perfect.
Any questions?
Don't
come on, y'all. Y'all were awake this morning. No questions?
This is easy. Wow. Well, hey, if you guys ever hear or see of anything and you're like, there's something in the law prohibiting this, just reach out. I will leave some cards here. I can't say that is a promise, but it is definitely something we are happy to put our eyes and ears on. So thank you guys for everything you do, and thanks for helping us be better. Thanks for you guys. Oh, you.
Trying to turn some of the mics off, y'all. Um, I'm gonna put him on the spot for a second since we're running ahead. TJ, would you mind coming up and giving everybody an update on the detention center? And now he's mad at me because he just walked in. Also, I'd like to recognize him. He's also one of our commission members, which is also the reason I can probably put him on the spot without him getting too mad at me.
Good morning. Good morning, everybody online too. TJ King, Director of Juvenile Court Services here in Madison County. We have attempted to make a regional detention facility. This is for pre-adjudicatory cases only. But we are looking from what we currently are is at 8 beds. And over West Tennessee, excluding Shelby County, I think there's 149 beds for West Tennessee juveniles. So what we have done is we have put together a plan to make 48-bed facility. All right. Initially, what we're looking at staffing is a 32-bed facility, but we're going to go ahead and build a 48. We have pitched that plan, which is a $69 million plan, to the governor. That meeting was held 2 weeks ago with Mayor AJ Massey doing that in front of the governor and his staff. It was a promising meeting, but nothing was said, nothing was given, nothing was promised. So right now, we still just have a plan, and we are waiting on the governor and his staff to say yay or nay. And so what that means is we're probably looking at 2 to 3 years down the road. But I mean, that's me giving you the real honest update. But that's where we stand. If the state of Tennessee isn't able to accommodate a regional facility, then Madison County is looking to expand probably half of that. We'd probably be looking at a 24-bed facility if Madison County has to fund it. But that's where we stand. But any questions, comments? Okay. Is that all you need? All right. Thank y'all.
Thank you, TJ. Anybody online or in the room have any other questions? As for TCCY, coming up, we have Southwest Council will have a legislative event probably the end of February. Information will come out about it very soon. We have our State of the Child report that will come out. That'll be around January 8th. It's due to the governor's office. That report is due every year to the governor's office on December 31st. So our data team in Nashville right now is working very hard on it to collect all the data that goes into that one very large statewide report. And it will be released to the public about 2 weeks after it shows up at the governor's office. We push it back into January because we know everybody's gone for the holidays. So it comes to if you're on, I know most of you are on my email list, or Sasha's or Dana's emails, or if you're on our regular general TCCY email, you'll get it straight to your inbox to read that report. We used to print them out and deliver some of them. Printing's gotten quite expensive, so it's easier just for that digital one. But that'll come straight to your email beginning of January. And then also look for an email announcement shortly about registration opening for our Children's Advocacy Days. This year, that'll be March 9th and 10th. That's our Nashville event at Trevecca. March 9th is the half a day now. We used to do 2 days, Tuesday and Wednesday. Now, funding issues, we pushed back. We only do 1 full day of CAD. And then that first day, March 9th, will be a half a day of advocacy training. Both, as far as we know yet, Sasha and I are on the planning team, as far as we know, both will be at Trevecca. First day will be about a 200 person limit. The second day will be about 700 person limit. I do registration, y'all. If you forget to get in, holler at me. I'm also the one that sends the registration email out. So holler at me if you don't see it. But that's coming out in January as well. So if you want to join us for CAD, I promise you, I tried to get the first day last year, YouTube. They didn't do it, but I'll push again for it because advocacy training, I think, was really a new experience for us, and it'll be really cool. The second day, our full day of CAD, we usually do streamed from YouTube. So if you can't join us, but please join us. If you can't, though, hopefully you can stream it on YouTube again this year. Sasha and I will work on that one too. Anything else? Dana has an event coming soon. She'll announce. That's her stress and humor. She had to push it back. It'll be at the beginning of the year. Sasha will have a legislative event coming up early spring of 2026. For those online, April 16th for ethics training at UT Martin through the Northwest Council. Dustin Keller is our speaker for that. Anybody in any of our mental health agencies or anybody in the room have announcements, events coming up, new programs you'd like us to be aware of? Oh, our West Tennessee Summit, that's through our Resilient Tennessee Collaborative. That will be sometime in April, so be looking for announcements for that. That's our whole regional summit working with our ACEs. That's with our ACEs work. Okay. Oh, some of our reports, our annual reports are out online as well. No other announcements? We are waiting on lunch. For those in the online, you don't get lunch. You'll have to be on your own today. But for everybody in the room, our lunch should be up in just a little bit. And that's it, y'all. If you have not updated the Juvenile Justice Directory, there's 2 copies on the table over here. Take a look and see if your email contact information's correct. Also, your judges and things will be on that as well. Our mental health providers, make sure you're on it. Yvette, I think you're updated. Make sure you're updated on it. And then, like I mentioned, Stephanie and everybody's on it as well. I try to update that quarterly, so before I send out the next follow-up email, I should have it updated. Be looking for your certificates and things like that on that same follow-up email. Anything I'm forgetting? Okay. Thank y'all for joining us online. We're going to have lunch now.